Good morning everyone, and thank you for joining us today for the Lowitja Institute's roundtable meeting on the cultural determinants of health. My name is Dr. Janine Mohammed. I am an Arungagana woman from Point Pearce in South Australia, and I'm very proud to lead Australia's National Institute for Aboriginal and Torres Strait Islander Health Research. I'd like to begin by paying my respects to the Wurundjeri people of the Kulin Nation. I acknowledge elders past and present and future emerging generations. I also acknowledge the people and the country from where you are all joining us today. I pay my respects to Aboriginal Torres Strait Islander colleagues who are here online and in the room with us today. And I would also like to thank everyone who is participating in this meeting and for your interest in contributing to a wider embedding of the cultural determinants of health in policy, programs and service delivery. Before we go any further, let's pause to reflect upon the importance of the Acknowledgement of Country. This is an important cultural protocol that enables us to acknowledge some fundamental truths about this place we now call Australia. Acknowledgement of Country reminds us first and foremost of the long-standing and enduring connection that we as First Nations people have to our country. We have never ceded that connection or our sovereignty. It reminds us that when we are talking about the cultural determinants of health, we are not just discussing some abstract concept invented in the pages of an academic journal or a report. Rather, we are talking about a living, breathing reality and a remarkable, extraordinary achievement of cultural continuity. Just to ensure we're all on the same page, the image on the slide in front of you is showing you a 6-metre tape representing our connection to this country of more than 60,000 years. That is, that 1 metre equals 10,000 years. The period since colonisation would amount to a tiny fraction of that tape, perhaps the space occupied by just 2 fingers. When I see signage and other acknowledgements of our achievements as the oldest continuing cultures on Earth, like the one you see on the slide, I can't begin to tell you how great it makes me feel. It's a very personal reminder that historical truth-telling can be so powerful and such an amazing health intervention. And it's a far cry from when I was a young girl at school learning about the brave white explorers who discovered this place we now call Australia. I remember the uneasy feeling in my stomach as we learnt about the primitive savages that roamed the lands here in Australia, living simple nomadic lives, and that my culture was dead and only something that you could find in a museum. As a young girl, I knew that this wasn't the true story, and I was confused and upset by what I was being taught and also by what I wasn't being taught. At school and at university, I learnt nothing about the rich and complex cultures and knowledge systems of our ancestors. I learnt nothing about their technological ingenuity, their sophisticated healing practices, or their sustainable land management practices anchored in the ways of knowing, being and doing. Practices that have existed and continued for tens of thousands of years, shared through complex kinship systems and passed down through systems of law, ceremony and of course song. Since time immemorial, Aboriginal Torres Strait Islander people have held a holistic view of health and well-being that incorporates the multiple realms of mental, physical, cultural, environmental and spiritual health and of course well-being. So it makes me smile when I hear academics getting all enthusiastic about the latest new paradigms in public health like planetary health. Our Indigenous peoples, of course, around the globe have been practicing planetary health for tens of thousands of years, understanding and respecting the intricate linkages between the health of humans and other life forms, including, of course, country. And if only there were more of those early explorers and that they'd paid attention and really respected our knowledges, how much healthier might we all be now, and how much healthier our lands, our waterways and our ecosystems would be. Unfortunately, the explorers' discovery skills were limited by their racist colonial worldviews, which have had such a profoundly damaging legacy, meaning that so many non-Indigenous Australians are still incapable of seeing us for who we really are. And I love the truth-telling and resetting the record of Bruce Pascoe. And who are we really? We are, I believe, strong, resilient people with powerful values and diverse, strong cultures and knowledge systems. We have survived the traumas and brutalities of colonisation, and I'm sure that a large part of our survival can be traced to the protective power of our cultures. If wider systems recognised, embedded and celebrated our cultural determinants of health, how much stronger and healthier could we be? I grew up knowing about the cultural determinants of health because they were embedded into my everyday life, into my relationships with family and my country, and into my understanding of my responsibility to care for our family, our elders, and of course country. Being strong in my culture and my cultural identity helped protect me, I believe, from the slings and arrows of racism that I experienced whenever I ventured into dominant culture spaces like mainstream schools and health services. But as a child, I didn't use that terminology, of course, the cultural determinants of health. It was quite simply just about us being who we really were, our authentic, proud selves in the face of what you were being told about yourself and about your people. Dr. Nori Brown was probably the first person I heard talk about the cultural determinants of health, and that was some years ago now. And she described the cultural determinants of health with a thematic approach to the articles of the UN Declaration of the Rights of Indigenous Peoples, or the UN DRIP. She says they include, but are not limited to, what you see here on the slide, so I invite you to take a photo of that. Dr. Brown is amongst a number of leaders in Aboriginal and Torres Strait Islander health who have contributed to the growing literature around the cultural determinants of health. And I'm also grateful for the work of Professor Kerry Arabina. You will have all seen her work referenced in the report prepared for today's meeting. Professor Arabina describes the determinants as a rights-based approach to health, referring to the UN DRIP as articulating the rights of Indigenous peoples to live a cultural life underpinned by good health and wellbeing, self-determination and leadership. Over the last decade, the Lowitja Institute, along with many others, have committed research and other resources to understand the ways in which culture as a determinant of health can be embraced to improve health outcomes for our people. The Lowitja Institute is really proud to have helped and supported the Merrick-Kawayu study, a longitudinal study that looks at how our Aboriginal and Torres Strait Islander wellbeing is linked to connection to country, cultural practices, spirituality and language use. Defining the Indefinable is the name of the first known literature review on the cultural determinants of Aboriginal and Torres Strait Islander health, and was undertaken as a part of preliminary work for the Merrick-Kawayu study. The review helped to establish 6 broad cultural determinants or themes, along with a number of subdomains or indicators, and these are on the slide. Again, please take a photo, feel free. And as some of you may know, my background is in nursing, and I was previously the CEO of the Congress of Aboriginal and Torres Strait Islander Nurses and Midwives. One of the most significant examples of the cultural determinants, and one I'm proud to have been involved in, is the revitalisation of birthing on country, which is described as a metaphor for the best start in life for Aboriginal and Torres Strait Islander babies and of course their families. But first up, let me remind you that birthing on country occurred for many thousands of years before women were removed to birth in other settings. So hence, from a historical perspective, it is a relatively new phenomenon to not birth on country. So birthing on country refers to maternity services that are designed, developed, delivered and evaluated for and with Aboriginal and Torres Strait Islander women that encompass some or all of the following points on your slide. Again, please feel free to take a photo. But this does not mean that birthing on country should be understood primarily through the lens of a health program or service. For us, it is about revitalisation and restoration of culture and all of the benefits that come with that. It's important to understand that the cultural determinants of health are not a pillar in the model for the social determinants of health. For me, the cultural determinants of health are foundational for each of the social determinants, and they are unique to Indigenous peoples Therefore, they are interwoven with the social determinants. So when we talk about housing and education as social determinants of health, we have to also consider the interplay with the cultural determinants of health. Let me give you an example with housing. On Stradbroke Island, the Quandamooka people have come together to build housing. This has led to nation building as people have come home to live. It's given them a sense of purpose and a place to grow their roots. As one of my Atlantic fellows, a Quandamooka woman, Pikiri Ruska, shared with me, people have recovered from the traumas associated with colonisation and have rediscovered what it means to be well, living back on their country. And if you want to know about how important the cultural determinants of health are for education, make sure to watch a deadly film on Netflix at the moment, actually, In My Blood It Runs. That film is also a reminder of how hard Aboriginal and Torres Strait Islander leaders and advocates have worked to generate a wider understanding of the critical importance of the cultural determinants of health. The challenge facing us is to continue translating this work into policies and practices that have a real and positive impact in the lives of Aboriginal and Torres Strait Islander peoples, of course, across Australia. It's a challenge that I hope everyone here today is ready, willing and able to take up. And just a note of caution, of course, this work means challenging Western paradigms about health. It means integrating your own worldviews and usual ways of doing business. It means developing an understanding of and commitment to cultural safety. Often there is some confusion about cultural safety and cultural awareness. They are very different. Cultural awareness training is a comfortable exercise often for members of the dominant society and actually others us as Indigenous peoples by examining our culture. Therefore, the gaze is outwards and there's a simplistic notion of how to treat Aboriginal people using a tick list, perhaps. Cultural safety, by contrast, the training asks you to turn your gaze inward and encourages members of the dominant society to actually get uncomfortable and examine their own worldviews, assumptions, beliefs, and how these are formed intergenerationally. Cultural safety, thus, has the power to be transformative in challenging entrenched power dynamics and, of course, Western ways of doing business, the normal way. Another powerful characteristic of cultural safety is that it asks people to step into their responsibility and be agents of change in systems for Aboriginal and Torres Strait Islander people, because we can't do this alone. And of course, I'll never forget our Indigenous sports carnivals that we used to hold in the 1980s. For me, it was like our modern day corroboree. Different nations who came together to share knowledge, stories, genealogy, and talk about our children. But it was about so much more than what went on out on the sporting field. It was about pride, it was about restoration, it was about nation building. It was a level playing field for many of the players out there. But when it came time to evaluate whether funding should continue for this program, the funding agencies could not see or understand or value the importance of this event for our cultural determinants of health and our cultural connection, and it was defunded, and we saw that happen a lot after ATSEC was abolished, of course. Today I hope we can make some real steps towards making sure that this never happens again. I hope that we can all get on the same page with a shared understanding of what the cultural determinants of health are and why they matter. I hope that we all share a commitment to ensuring the cultural determinants of health are embedded in our ways of working and going forward, whether in research, practice, policy, or in programs. We have a long way to go when it comes to building a national identity that we are all a part of, that we all celebrate, and of course we all benefit from. If we can centre the cultural determinants of health in our work, then I believe it will lead to nation building that will benefit all Australians. We are all in this room together today because we have something to contribute. Let us work together, create a powerful legacy, for our children to inherit, so that when we are all retired, the work that we have committed to today is a part of the architecture, the system, still producing real and meaningful outcomes. The legacy of our work on the cultural determinants of health will of course be reflected in the strong health, well-being and cultures of our children's children. Finally, I would like to thank and acknowledge everyone whose work has brought us to this point today, and a big shout out to all of my staff for all of your care and your preparation. I know how much this work means to you, for all of us. Thank you, everyone.